Welcome to another episode of Achievements, where we shed the light on special individuals who are achieving astonishing accomplishments in their fields. I'm your host Abdulatif Lanizi and joined by my colleague Fatma Al-Awadi. Good evening, Fatma.
Good evening, Abdulatif. Thank you. Yes, dear viewers, we have a new story today and a new guest, and we can't wait to share their story with you. So stay tuned after this report.
A successful identity is built on things a person has done. Your most important accomplishments are a very important way for you to measure your success. Colleagues, competitors, and the general public can look at a person's achievements to figure out how successful they are. Most of the time, putting in a lot of work pays off. Most people think a successful life is one of a lot of things to be proud of. When you finish a task, you win over problems or other people. Achieve means to work together to reach a hard and challenging goal. Everyone should be ready to help out and work together if they need to. There are many ways to reach a goal, but in the end, it's up to you to decide how it will pay out in your life. In their careers, some people want to get rich and will be well known. Some people think that even small victories are reasons to have a party. We're all different, so we all have our own thoughts on everything. In the end, though, everyone wants to be happy, and everything you do in life will help you to get closer to that ultimate goal.
Welcome back, our viewers. Today we are thrilled to have Dr. Anwar Al-Najjar, a doctor in family medicine, is here with us today. Doctor, thank you for being here with us at Achievements. We're so glad to have you and to know more about your field.
It's my pleasure to be with you.
Thank you very much, Doctor. Thank you for being with us. We're going to start with our first question. If you could please tell us and our dear viewers, what has led you to pursue family medicine field?
If you want to know why I chose this career for myself, you need to know what is family first. Family medicine, what is it exactly? When I finished my graduation from the medical school, actually I didn't know where to go. Then I start to know about the specialties. We know about the major specialties like medicine, surgery, pediatric, obs and gynae, but there are some specialties that are not known to many of us. So I started to search, then I found family medicine. Family medicine is a specialty that takes care of the person as a whole, globally. It takes them from 3 dimensions. For example, if I take Fatma, for example, I want to diagnose her for a certain disease, I would look at her from 3 dimensions. What are these 3 dimensions? Number 1 is the physical disease. What is the diagnosis of the physical disease? For example, hypertension, diabetes, bronchial asthma, whatever. Then I would look at her at the social relationship of the disease with her social life. Is the disease affecting her social life, or the social life is affected her, causing the disease? For example, some of the patients like bronchial asthma, they have social problems to deal with the disease. Like, for example, they need to be absent from their works, they need to be absent from their schools if they are students. So I need to take care of them when I'm treating their disease. At the same time, the social life can affect the problem. For example, the mother is a worker, for example. She wants to take care of her children. Then I need to take care of this also. Also, I need to take care of the psychiatric aspect of the person. So when I'm dealing with the patient, I'm dealing with them with these 3 dimensions. Okay. Also, I need to take care of the inside of the patient with these 3 dimensions and the outside. So also the appearance is important. You know that, for example, now everyone likes to be beautiful. They want to be in their best look. So I also take care of their skin, their hair. So I try to take care of many things, of their children, adulthood, elderly, and also the caregivers. So when I look at this specialty, I found that taking this specialty, actually I'll be taking care of my whole family.
That's amazing.
Yeah, exactly. So this is an amazing specialty that you would know many things, you can treat many things, and with many things that attract you. And since I would like to help my patient as much as I can, that's why I chose this specialty.
It's really important and wonderful.
Yes,
Yeah.
I've never actually heard someone explain family medicine like that.
Me too.
Really, we applaud you for that, Dr.
Yes.
Anwar. You did a great job, by the way.
Yeah.
Thank you so much.
You actually explained it from every way that we need to understand it, because a lot of people, especially here in Kuwait, they have this misconception with it, and you told us
Yes.
before we start the interview, and actually immediately, myself, I didn't know what does it for.
And this
Family
creates
medicine,
a conflict, actually. Like, for example, when the patient comes to the primary care centers, they think that the family doctor would take 5 minutes to diagnose a problem. Actually, it's not the situation. I need to take some time with the patient, asking them many questions to reach a diagnosis, considering all of these aspects. And this creates some problems. You know, some patients, they would not like to stay for a long time. But if we want to diagnose appropriately, then we need time for that. So and history is actually the most important part to diagnose a disease. They think that if we did like some investigation, they just come and I want this investigation. Investigations, they don't diagnose a person. We request investigation based on what we hear. So if I ask you many questions, I would know what investigation I would request. Accordingly, we will diagnose. Always we say that history is like 85 to 90% of the diagnosis is by history, and the remaining 15% is examination and investigation. Can you imagine that?
Wow, that's very thorough for history. So history is number one in diagnosing whatever illness or ailment that we have. Yeah.
Yes,
So,
it is.
Doctor, can you tell us exactly what's the most common cases that your patients comes to you to seek for you for like a solution about it? Most common cases, health
For
conditions.
now, mostly like diabetes, hypertension, mostly chronic disease, bronchial asthma with many different age groups. Of course, since I'm a specialist in quit smoking, so also I have a patient with
Quit smoking?
Quit smoking specialist.
We need that. We need awareness.
Yeah, exactly.
Please, doctor. I mean, here most of the men, most of my friends, my cousins, like almost all of them, they actually smoke, and it is common issue, really, here in Kuwait.
And if you consider also the females, now they are starting smoking, and the vape that attracts adolescents, especially, or the young adults.
Yes.
This is real problem.
Yes.
And also part of my job, also my work, I'm specialist also in aesthetic medicine, which is beauty. So also I take care of my patient when they come to me. For example, she is diabetic, hypertension, or whatever disease she have. She would like to be also at the same time. She needs herself to be beautiful.
Yes.
So I consider her chronic illness at the same time I do her aesthetic procedure. For example, trying to do a Botox, filler, or whatever kind of aesthetic medicine procedure.
Wonderful.
Wow. Okay. And Dr. Anwar, you just told us that you are famous for the quit smoking and the campaign that you've launched on your social media. And of course, I'm a personal follower of your account. Could you please tell our dear viewers about how the procedure is? How do you tell someone to quit smoking? Do you convince them? Do you show them pictures? How does it go?
We know that smoking is addiction, and you want to convince a person that you want to get rid of this addiction.
They lie actually about that. It's not addiction. They say no.
They lie.
This is a way to tell that, that to have an excuse for what they are doing. Actually, it is addiction, and it is categorized worldwide as the third substance of addiction after heroin, cocaine. It's before alcohol. Can you imagine that?
Wow.
So it is an addiction. So since it is addiction, addiction, it's difficult to treat, but it's not like impossible. It's difficult, but not impossible. To convince a person, you need different ways, and the approach depends on the patient. When I take history with them, I stay like 1 hour with the patient, taking the history and providing the appropriate way of management, and convincing. So I start to select the way according to the patient. So some patient I would tell them about the benefit of smoking. Some of them I like tell them about the complication that they would have. Some patient I do a questionnaire before they enter to me. I ask them what led you to come to me, for example. From what they answered, I try to use it as a way. And also I ask them about their motivation. I categorize their motivation. How important for you, I scale them from 1 to 10, how important to quit smoking, and how you feel like you are confident to quit smoking. From these questions in the questionnaires, I select the way I convince the patient. Also, I use what is called motivational interviewing. It is a way of taking history and convincing people. It's a very, it's not very new, but it is a way to know. Motivational interviewing, it means that I motivate the person from their words. For example, if they say, like, for example, I hate cigarettes because my children, they are looking at me, but I cannot quit. So I take this information that he said it, then I try to motivate him from what he said.
Wow.
This is a way.
So
from the point that when his children looked at him.
Yes,
you try
this is
to
an
take
example.
Yes.
So you can create willpower from his words,
exactly,
and it's like turning it against him, but in a good way.
In a good way, exactly. I try to escalate his motivation.
That's amazing.
And make it more achievable.
Brilliant.
When we reach this level of that, I want to quit smoking, and I'm convinced, and I will do whatever it needs, I explain to them what are the modalities of treatment. Then and again, the modalities of a treatment depend on their addiction. If the addiction is high, then I would recommend more than one way of management.
Yes.
Of course, the motivation all through the process from day one till they quit smoking, we are together all the way together. So these methods and these procedures will help the person, but it is a continuous process. We may suggest something, and I explain to them that when you attempt and you have like not a failure, but you like slip one cigarette, it doesn't mean that you failed. It's a way for going again for the cycle. It's like a cycle. You need to accept yourself and accept what you are going to do.
Thank you. That's really the way you actually explained it. It's really good way. I mean, I think it's really helping for a lot of people, and we hope that we can raise the awareness and they can come to you, doctor, and you can help them.
I hope so. And actually, I would like also the country, Kuwait, they try to do more about smoking. What we are seeing as campaigns is actually very minimal. You know, it's like a war against the people. They try to sell different types of smoking modalities, cigarettes, vapes.
It's a whole market.
It's marketing. They start to sell the IQOS, and they try to market it as this is better than this. This is better than this.
This is safer. This is but it's all the same.
This is the most ridiculous thing that I've ever heard.
Toxins.
Exactly.
Yes.
Exactly. So each one of them, they have their own danger thing. So we need to raise the awareness. I hope we have a very big campaign regarding this.
Inshallah.
I'm trying to do it by myself, but I hope it is bigger than this.
Yeah, inshallah. And of course we can help you with it. But doctor, since you were talking about that you have to keep continuing and you have to keep connection with your patients with the process of them like trying to get quit of smoking. So doctor, how do you, considering their needs, how do you keep a strong relationship with your patients?
It starts from day one. once you let the patient talk and try to give them the chance to talk and tell you everything, and you give the time and you tell them from the first day, you have the time, don't worry, I can listen to you, this will build up a good relationship. This will build up a trust. I build up the trust from day one. Then I start, of course, I have the communication with them through WhatsApp, for example. I give them a special number. I tell them anytime you want to send any messages, just send to me. It's not important to come to me to the clinic. You have the right to send to me whenever I see the message, I will answer
Perfect.
you. So they need this attachment with their doctors. You know that they can look and search things from the Google and anywhere, and they can take wrong information. I don't want them to listen to anyone and to have wrong information. I want them to ask me personally. They may feel like lazy to come to the clinic, so
Yes.
ask me by messages at any time you want.
Yes.
Thank you.
Thank you very much, Dr. Anwar. We still have more questions. Dear viewers, we'll be right back after this report.
Dr. Anwar al-Najjar is a doctor of family medicine. She helps treat chronic and physiological diseases. In addition, she also helps in helping individuals quit smoking and treat skin changes. Dr. Anwar is a hard-working doctor and has managed to help many others. She has always been focused and dedicated in her work, and that has helped her accomplish many achievements. In addition, family medicine is a vital branch in healthcare that focuses on providing medical care to individuals and families across all ages. Dr. Anwar has managed to accomplish a significant impact on the well-being of her patients and community. Dr. Anwar's journey in medicine began with a strong sense of compassion and desire to make positive impacts and changes in people's lives. She also developed a deep appreciation for the holistic approach of family medicine. As a family medicine doctor, Dr. Anwar seeks to provide a wide range of medical services to patients of all ages. She is well educated in diagnosing and treating a variety of health conditions, from childhood illness to managing chronic diseases in adults and caring for the elderly. Certainly, Dr. Anwar has faced several challenges in her career. However, her dedication to improving patient outcomes remains steady. Dr. Anwar, we are proud of you and the things you've done. You have made us all proud.
Welcome back, dear viewers. We are still here with Dr. Anwar al-Najjar. Now, Dr. Anwar, how do you educate your patients in maintaining a healthy lifestyle?
It starts first by knowing what are the wrong lifestyles that they are doing. For example, the person might have that he is not, for example, eating good or healthy diet. He's not doing exercise. He's a smoker. He's not sleeping well, not drinking water. So I try to put everything in the paper. I write it down and I tell my patient which one you think you can start with. I don't select which one I would like to educate the patient. Maybe if I would select smoking, for example. But it's not the patient's idea. The patient is not ready yet to start with this. He's ready to start with something else. Always we try to select the thing that is simple and easy, because when we remove one from the area, he will feel successful.
Yes.
That he felt that, okay, for example, he selected to drink water, which is maybe the easiest thing he can do.
Okay.
It's okay.
Or maybe walking. Starting to walk.
It's okay.
Yes.
Whatever he select from the wrong lifestyle he's doing is okay for me. This would actually make him feel better that the attempt is successful. As much as I make the patient feel the successfulness, as much as I can change his lifestyle. So we select the thing and we try to start easy. And we select one. We don't select more than one.
Okay.
We select one. For example, if we selected like exercise, I always tell them tailor it to the patient idea, what he can do. Maybe he has, I want him to do like running and he has like knee pain, or climbing the stairs and he have knee pain. How can I ask the patient to do that? So always I tell them what you can do.
Right.
From that way, I can teach them and educate them and promote the healthy lifestyle. Whatever they can do, even increasing their daily activity, to me is a change.
Yes.
Change is difficult. It's not something easy.
Not a lot of people up to the change. Yes.
Yes,
But when you choose it in small steps and simple
exactly.
steps.
And simple steps and related to the patient, tailor it to what they want to do.
Right.
It's not me. Before, maybe you remember some of the doctors, they would say, you need to walk. You need to eat healthy. You need this ordering way of changing lifestyle is not effective anymore.
Yeah, it's hard for them to comply with these orders because we hear it a lot. So it's no longer has its value with the patient.
Exactly. When you just order your patient, then they will just say, okay, but he will go out of your room. He's not understanding anything. And if you give more information, you know that 20 minutes is the maximum. Maybe the patient would listen to you. So if you give more information during this time, they would not listen. The beginning of the consultation, the end of the consultation is the most important time. So you focus on these times to make the patient more aware and reach an agreement. Whatever agreement we reached, we can do it, and we have more and more consultations to work it out.
Yes, that's really perfect, actually, the way you explained it, doctor. And thank you about that. Thank you for the hard work that you are doing for our community. We need it, and it's actually perfect. But getting back to you, doctor, professionally, how do you stay up to date with the latest research? Because as we know in this actually field, the technology, the ways, we actually have new ways every month or every year. So how do you professionally, how do you stay up to date with it?
This starts from the time that I decided to be a doctor. Then you need to know that your life is studying.
Wow.
It's
all of it until now?
Till now, okay. So
you never stop learning.
We never stop learning. That's why my children, they don't want to be they don't want to be doctors, because it's always they need to study. They always look at me, you always study, we don't want to be like you. So it's actually, you need to learn, to study, to enter many workshops,
seminars,
the virtual life is excellent. It helped us as doctors like to attend courses and conferences through the virtual communication.
Yes.
So now maybe being up to date is easier than maybe before for my colleagues.
Before social media, maybe in the internet.
Yes, exactly.
Okay.
Exactly.
And I remember sometime during COVID, actually, you had a very successful campaign running for the quit smoking, right?
Yeah.
Yes.
Exactly.
Could you please tell us about a challenging case where I know you've said before we started the show, some patients, they would fall off the success wagon.
Yes.
They would go back to smoking after they were very successful in quitting. So could you please tell our dear viewers about that?
Yes, there are some cases they go back to smoking. As we said, smoking is addiction. Tobacco is addiction. So to treat addiction needs a long time. Some patient would think that 1 month or 2 months is enough. No, we need more than that. But always I explain to them that a slip, which means that smoking 1 cigarette in a week, is not considered as a failure. It's considered like a mistake, a simple mistake. But some of them, they don't do only the simple mistake, they actually go back to full smoking. Always I tell them that doing an attempt to quit smoking takes you closer to your final complete hold of quit smoking. Don't take it as a complete failure. It's actually a way for a successful quitting smoking. This can happen. Actually now they consider treating smoking like treating any chronic disease. Now diabetes, for example, is a chronic disease.
Yes.
You need to continue on medication and follow up for long time, for your life. It's the same for smoking and quit smoking.
Yes.
When you treat smoking, it means that you will need to follow up for a long time. You need to be patient with yourself. You need maybe the medical treatment for a long time. Don't feel that I go back to smoking, it means I'm a failure. No, that if it's like that, then a patient who's diabetic who still on medication, he's a failure man.
So is it like binge eating too? Maybe cheat day meal, something like that for people who are going on strict diets,
exactly.
right?
When a person, and I tell them this example. When you are in diet, sometimes you like slip. You just take one day, you see some food and you just
French
eat.
fries.
Yeah, for example, or
happened
sweets.
to
Some
me.
people, they would like sweets. So I tell them, just forget about it. Don't think about it and
Go back.
Go ahead.
Yes.
Start again.
Perfect.
We are all together. Don't worry. Some of them, they would send to me a message that, Doctora, I'm sorry. Yesterday, for the last 3 days, I was in a very terrible. One of my patients, actually, his wife, she went into surgery, and at that time he felt very stressed, and he smoked for 3-4 days, and then he told me, I'm back. I told him, no, you are not back. Don't worry. Since you called me and you said, I want to start again, it means that you are still in the safe
have willpower.
And you have the insights. The most important thing that you have the insight that now you are back and you want to go back to quit smoking.
Yes.
This insight, many people, they don't have it.
It's like the conscious that's telling us what to do.
Yes.
Yeah.
Since you are still conscious, better than a person who would tell you that smoking is not dangerous and not doing anything. He's actually trying to
manipulate or
yeah,
maybe lie to
manipulating.
you. Yes.
Yeah, and trying to say things which are not correct.
So, doctor, there's actually something I need to know about it. It's really urgent, and we are actually focusing on the smoking spot because unfortunately we have a lot. So, doctor, how much time does it take usually for patients to quit smoking?
Always we say that when you pass the first 3 months with the medication, you are more towards successful quit smoking.
And after that, they have to quit it like from their mind because they think that if I'm upset or if I get cranky, I need one more cigarette, and then unfortunately they get back, as you say, for one of your patients.
Yeah, exactly. But you know, the willingness sometimes is difficult because it's something in the blood. It's not only, it's like the nicotine is in their blood, their receptors in the brain, it's like saturated with the nicotine. So the 3 months is not enough to get back the nicotine, to remove all the nicotine receptors and get back the chemical, the original chemical of the body. So it would need long time. And the desire is not the only thing that is important.
Okay.
It needs a long time. 3 months is, some people would say, if you pass the 3 months, then okay, I'm done. No, it's not. You need to continue on medication maybe for a year, maybe for 2 years, but at the end you will be successful.
I thought they can quit it with 2 weeks.
Yes, when we start the medication, you will throw all the cigarettes and everything, but to get back the body a healthy state that all the receptors are back, no, this would need time. Especially if the patient is a long time smoker, like for let's say 20 years. All the receptors now is saturated with nicotine. A person who starts smoking at a young age, like 17-year-old, they will be more difficult to quit smoking. And by the way, in Arabian countries, we have the youngest people to smoke.
They start smoking for like 10 years old.
I've seen one who's 7-year-old. So it's really
dangerous.
7-year-old.
So you're talking about the cilia in the lungs.
No, it's the nicotine receptors in the brain. The nicotine takes the receptor, which is it's supposed to be for dopamine.
Okay.
But it takes the place of the dopamine and replaces
then
it starts to build up more nicotine receptors. He needs more and more. So he starts to make more receptors for the nicotine. So to get rid of all of this nicotine, we need and replace it by again with the dopamine. This would need some time.
Yeah. So yes, doctor, you also told us about a little bit about asthma and also diabetes. What are your strategies for the patients of those diseases since they're chronic?
Any chronic disease, they need to have a self-management plan, and the self-management plan need to be agreed with their physician. What do you mean by self-management plan? You need to know what are the emergencies, how to deal with the emergencies, what you need to do, and what are the medication for the acute attacks or acute emergency, and what are the medication for the chronicity of the disease. Like for example, bronchial asthma. Always the people, they think that bronchial asthma there is no treatment. Actually, for bronchial asthma, maybe we don't have a complete treatment for the immune system, but we have a treatment to make the lungs stable. And the most important thing is to control the symptoms of bronchial asthma, especially for children, because they need to grow growing if affected by chronic disease. If they cannot breathe healthy and take proper oxygen, then their growth will be affected. Yes. So we need to control the symptoms and make the oxygen is stable, rather than thinking about how to stop the immune system of attacking the body itself. So agreeing with your physician, what is the goal of your management plan or the goal of treatment, this is the most important thing. Yes. We need to agree that, for example, bronchial asthma is to control the situation, to reduce the number of acute attacks and the seriousness of the acute attacks, not to be admitted to the hospital as much as we can. Okay. So this is the goal that we needed, to sleep well, to be able to study. These are our goals. Some mothers, they would come to us, there is no treatment for bronchial asthma. Why should I put the nebulizer and other things? If you stop giving the nebulizer, then these goals will be not achieved.
I see.
And your child will be affected and not grow well.
Yeah.
That's amazing. Dr. Anwar, thank you very much for these thorough answers, and we are very happy to have you here, but unfortunately our episode has come to an end. So if you could please just tell our dear viewers one last piece of advice.
I just want them to understand what is family medicine. If you have a problem, you need first to go to the family medicine doctor. He will direct you where to go. And actually, in many modern countries, they cannot go to any doctor except that they pass to the family doctor. He diagnoses you, he will tell you, and give the time to the doctor. If you give the time to the doctor, he will reach a proper diagnosis and you will be happy. Knocking the door and trying to be fast is not helpful for you.
Yes. Thank you very much, Dr. Anwar Al-Najjar. We are very happy to have you here, and you are amazing in explaining every single question that we were asking. Actually, yes.
It's my pleasure.
Thank you for being with us. Thank you for the greatest information that you gave us. We are so glad to have you, and inshallah in the future you will achieve everything you wanted to achieve.
Inshallah, and you also.
Thank you. Dear viewers, we want to thank Dr. Anwar for sharing her story with us, and here on Achievements. Your dedication, actually, Dr. Anwar, and the pursuit of excellence serves a great goal for all of us.
We will see you, inshallah, in our next episodes. So goodbye for now.
Goodbye.